Hi. If you haven't done so already, go ahead and turn up the volume on your speakers so you can hear this very important message on peripheral neuropathy. You don't realize it yet, but in the next few minutes, I'm going to let you know about a little-known, non-surgical, drug-free approach to helping treat the symptoms associated with peripheral neuropathy. I'm going to show you how the Blueprint to Neuropathy program is able to decrease or eliminate the symptoms associated with neuropathy with patients, literally thousands of patients all over the country. The results we see with our program is a significant reduction or elimination of numbness and tingling, a significant reduction or elimination, pain, burning, stabbing, and that pressure type feeling that people get, a significant improvement in your ability to stand and walk, a significant improvement in your ability to sleep, and a significant improvement in your balance. And in some cases, we see a complete reversal of all neuropathy symptoms. Hi, I'm Dr. Anthony Galante, founder and chief clinician of Algonquin's Neuropathy Center. Not only are we a Blueprint to Neuropathy treatment center, I'm also certified in sports medicine, certified in the Cox technique, member of the ACA, the ICS, and I've been treating your friends and neighbors in the Algonquin and Lake and Hills area for over 20 years. The last few years, I've dedicated my practice to helping people overcome the symptoms associated with peripheral neuropathy. Symptoms like pain, burning, tingling, the sharp shooting pains, pressure, and the associated problems with walking, balance, and sleep. If you suffer with peripheral neuropathy, you're going to want to hear about Tom. Tom went through our treatment plan after years of suffering. Matter of fact, Tom was diabetic for over 10 years. 4 or 5 years ago, Tom developed a little tingling and a little numbness in his feet and his toes. He didn't think much of it, kind of went on with his life, but over time, that tingling, numbness got worse. And as it continued to get worse, the pain started and it became very sharp. It was difficult for Tom to walk properly, as also his feet would get very, very cold. During this whole process, Tom's balance was getting worse and he was afraid he was going to fall. To make matters worse, Tom had some weakness in his right foot and ankle that made it difficult to walk normally. Tom went to his medical doctor, who by Tom's own admission kind of didn't really address the problem, probably because they know there's really not a whole lot they can do for it. So Tom turned to the internet. He found out what other people were doing to help these symptoms. He found some people were doing B vitamin injections, some hot and cold therapy, using creams and gels, or the latest, greatest nutritional supplement. But no one was really getting any lasting relief. I've had patients that have been on medication for years. They're taking pain pills, antidepressants. I've tried creams and rubs. And yes, they're good for covering up and masking the symptoms and controlling the pain, but it's not really fixing the problem. So at that point, Tom had tried chiropractic. He had tried some exercises for his feet and legs. He had tried some hot and cold therapy. Nothing was really giving him any lasting relief. Then one day, Tom was on Facebook, came across our program. See, our program is different and unique because we get to the root cause of neuropathy. We don't just try to cover it up with medications. So Tom was very skeptical and almost didn't start the treatment plan, but he had a very strong desire to get well. And to Tom's surprise, it worked. He had a significant reduction in his numbness and tingling. His pains went away. His balance improved. And in his own words, he felt a lot steadier on his feet. So if you can resonate and you can relate to some of Tom's symptoms, I want you to hear about what Eleanor has to say about our program. Eleanor went through our program and also did very well.
Hi, my name is Eleanor. I live in Huntley, Del Webb. I came in to see Dr. Galante because I was having some lower back discomfort and I've had neuropathy, numbness in my feet for years. I've never received any treatment for my neuropathy. Doctors just acknowledged that I had numbness and that was it. I've been seeing Dr. Galante now for a couple of weeks, and the sensation in my feet have improved. My balance has improved with the treatments he's provided, and physically, my well-being, I feel much better. Thank you, Dr. Galante.
When Tom came in, and when Eleanor came in, and if you come in with neuropathy symptoms, we're going to do a few things. One, we're going to listen. We're going to really listen and find out how these symptoms, the pain, the burning, the numbness, the tingling, how are these symptoms affecting your life? Is it interfering with your sleep? Is it interfering with your ability to walk? Is it interfering with your balance? We're going to find out exactly how it's affecting you because that's what we want to improve. We're going to do some nerve testing to find out if you're a good candidate for our treatments. I make the analogy to a plant. If a plant is dried up and you give it some water and fertilizer, it's going to perk back up. But if a plant is dead, you can water it and fertilize it all day long, it's not going to help. So if nerves get to a certain point, we can't help them anymore. So if you are a good candidate for our treatment, we're going to put together an individualized treatment program just for you. that's going to consist of educating you on neuropathy. We're going to talk about diet and put together an individualized nutrition program for you. And we're going to add in some of the modalities we use to help improve circulation and heal nerve tissues. That includes low-level light therapy, rebuilder therapy, vibration therapy, and many others. So you may be wondering if our program can help you. Well, we're going to make it very easy to find out. Right now we're offering a complimentary consultation during the next 10 days. You can come in, we can find out if you're a good fit. During the consultation, you'll find out if you're a good fit for our program and a good candidate for our treatment plan. You'll find out the technology we use that won a Nobel Prize, the technology developed by NASA that helps to decrease neuropathy symptoms. You're going to find out how diet and nutrition affect neuropathy and affect the nerves. And you're also going to find out about a little-known therapy that you can do at home that's used by one of the largest cancer hospitals in the country to treat neuropathy pain. But most of all, we're going to find out if we can help you and we can help your condition. So right now, you have two choices. Number one, you can continue to do what you're doing and hope the neuropathy will get better. Now we know when we look at the research, there's not one case of neuropathy reported in the literature that reverse itself. So the chances of it going away are very slim. Most of the time, at best, neuropathy is going to stay the same. And if you're like a lot of patients I see, neuropathy is just going to get worse with time. Or you have a better option, your second option. Make that call. Let's go ahead and schedule your complimentary consultation, and let's find out if you're a good candidate for our treatments. If you are a good candidate for our treatment plan, I will tell you that. If you aren't a good candidate for our treatment plan, I will tell you that also and help you find someone else who can. I look forward to meeting you soon, and be well.